Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we are joined by Amanda Krzepicki, Policy Director of the Autoimmune Association. Amanda is based in Washington and spends much of her time on Capitol Hill advocating for patients. The Autoimmune Association helps autoimmune patients by sponsoring research, advocating for access to healthcare, and fostering collaboration to identify and explore the common threads that link autoimmune diseases. Like the Global Healthy Living Foundation, the Autoimmune Association works around the world, not just here in the U.S., to help patients.
Great, I'm excited to have a listen, Steven.
All right, well, let's get into it. Welcome, Amanda. Thanks for coming.
Thank you so much for having me, Steven. It's great to be here.
Yeah, why don't you start by telling our audience a little bit about yourself, how you got into patient advocacy, and we'll go from there.
Yeah, absolutely. So to give you a little bit of background about myself, I started my career working in a federally qualified health center where I worked with patients who were directly impacted by burdensome utilization management practices. I actually managed a mobile dental clinic, which went around to local elementary schools, and I saw children without their parents.
Where was this?
Alexandria City in Virginia.
Excellent.
So I saw all these students without their parents on a mobile dental clinic. You can only imagine the level of screaming I had to deal with on a day-to-day basis.
Oh my gosh.
So working on the bus, I teamed up with the school nurses and providers to make calls on behalf of patients to try to argue prior authorizations. And I truly felt the frustrations of the system from the ground up. It was a really eye-opening experience to see children experience these inequities. And I was doing this job while concurrently getting my master's of public health degree. So this really kind of pushed me to do that in the policy space. So I had another internship where I did Medicaid insurance policy for a while. And then I got my feet wet with my first job in the private sector, where I represented a few patient groups as well as nonprofits before coming in-house at Autoimmune.
Wow. So tell us a little bit about the Autoimmune Association. Now, many of our patients, as I'm sure you're aware, and by extension, many of our listeners live with an autoimmune condition. So tell us about the Autoimmune Association.
Yeah, absolutely. The Autoimmune Association is the world's leading nonprofit organization dedicated to autoimmune awareness, advocacy, education, and research. We represent over 50 million Americans, and more research needs to be done to get a worldwide estimate, with over 100 diseases, many of which are rare. So we've had a lot of resources on our website to help patients. We actually just developed a new question prompt list to help patients have more effective meetings with their doctors. And I'm currently in the process of revamping our policy page and our legislative action center to get our patients more involved in changing the healthcare system so it works better for them and their families.
Wow, well, that's fantastic. And thank you for doing all that you do. So you're based in Washington. Can you provide our patients some information on the basics of how legislation works, how patients can help influence legislators to come up with more patient-friendly outcomes?
Yeah, absolutely. So unfortunately, I have to tell everyone first and foremost, you have to throw away everything you learned in civics class and from Schoolhouse Rock.
What? How a bill becomes a law? I can't watch the video?
Right. No. I truly wish it was as simple as that song makes it out to be. But, with recently, the House has kind of thrown away normal order, and it takes years for things to kind of change in the healthcare system. So initially, you need an individual, more likely an organization, group of organizations, to come up with legislation, in this case, a bill, that is an idea that improves the healthcare system. That is what we would hope for, that it would improve the healthcare system. So you have to take this bill to Congress and have meetings with various legislators to see if this bill aligns with their priorities. So sometimes you have to do research on what they've worked on in the past. It helps if you're working with committees of jurisdiction like Health, Senate Finance, Ways and Means in the House, and Energy and Commerce, to see if there are members there who care about the same issue that you care about. Once you find a member, ideally one on each side of the aisle and one in both the House and Senate, or two, I guess, in both the House and Senate, you have them introduce the bill. That is the hardest step and can take years in itself. But after you have a bill introduced, then you need to put in effort shopping around additional sponsors or co-sponsors. So more members that are engaged in this bill and want it to move. Once you kind of have a majority of members or a couple committees who think it's really important, they might take the bill up for a markup where every member on that committee has an opportunity to kind of change the text of the bill to have it as they see fit. Once you have the markup, then you have the hearing, then you have the final vote with each side, so the House and the Senate. And perchance if those markups maybe didn't go your way and you've got two different bills on each side, then they need to conference those changes. And as you can imagine, all of this takes years. So it's the coming up with the idea, then having the members of Congress work on the issue, getting it up to a vote, getting it out of the House and Senate, and eventually getting it to the president's desk. So, it is a huge accomplishment for bills to get passed.
Yeah, first of all, that was a really good overview, I have to say, how Bill Becomes a Law 101. It does remind me of the cartoon. It also reminds me of Mr. Smith Goes to Washington. I hope I'm not dating myself too much. But yeah, that really is how it's done. Obviously, there's more to it than that.
A little, yeah. I mean, we left out all the midnight conferences and the sneaky changing of the text before the other party can see it. But, those are just the fun little tidbits you get working in DC.
Right. Those don't make it into the cartoon.
Yeah.
But no. That's right. That's the basics of it. And like you said, it takes years. That's something that we always stress. You don't just go to Washington and tell your story and expect a piece of legislation to become law. A few weeks later, it takes a long time. And sometimes it's just a matter of introducing yourself to your local legislators and continuing on over the course of many years. Do you have any good examples from your career of a great victory worth noting that we're talking about?
Yeah, actually, very recently. So there's the Medicaid drug rebate program, which recently had a proposed policy change come out. And this policy change would kind of affect how patients get their medication, because it's a very complicated process to very quickly explain, but I like to very quickly refer to it as a shower thought. So I feel like somebody woke up one morning, had this idea where they were in the shower, thought it was a great quick fix to a problem, and then forgot to kind of think the idea all the way through, think about the unintended consequences. So there's this specific policy in the MDRP where they wanted to stack all of the rebates that pharmaceutical manufacturers have across the system and make that the best price for Medicaid, which would bring, frankly, the price to zero, which sounds like a really fabulous idea, when you say it quickly.
Right.
But what the unintended consequences would likely be, like all of these rebates that patients are getting to make their drugs affordable for them across the system would then be eliminated. So patients would no longer have access to that benefit that they like and are using to afford their medications. And it's just a little bit scary to make that change so quickly without talking to people. So we had a letter. The Autoimmune Association has a coalition, the National Coalition of Autoimmune Patient Groups. And we had that coalition run this letter open to all patient groups, all 501c3 patient groups. And we got 31 other patient groups to say that they also would like HHS to take another look at this letter. We then also worked with members of Congress because they were going to have a hearing with Secretary Becerra, and we asked them if they would ask Secretary Becerra to review this policy and make sure that those unintended consequences were not going to harm patient access to their drugs. So we had Representative Robin Kelly ask during a hearing if he could follow up with her on this policy, and he said yes. So we have now on record that he has to get back to her office. And since that has occurred, and we had other support from other members of Congress as well, HHS has pulled back on this policy for this year. So we're really excited that they're going to be taking another look at it, working with manufacturers to kind of see the bigger scope of the rebate system in itself and how they can work to get more affordable drugs for patients as they intend, which we are supportive of. Obviously, we want patients, especially who are Medicaid dependent, to have better, cheaper access to drugs. We're always for that. But this is just like a huge win and a huge group effort.
Yeah, no, absolutely. First of all, I should mention that the Global Health Living Foundation was active in that as well. And of course, we're happy about the outcome. But it's an interesting example because it's not from the legislative side. It's on the executive side, going to the Department of Health and Human Services, which is interesting and can be even more arcane when trying to advocate.
Yeah.
But we won't get into that. That's a little more difficult. But it is interesting that even when it's not just the legislative side, that we advocate probably in all three branches, actually. So that's an interesting example.
Yeah, judicial advocacy is becoming a huge priority with all these different court cases that are buzzing around. it is complicated. As a patient organization, you have to work with lawyers because if you're not a lawyer, writing amicus brief is a couple steps above. So you got to get some support there. But yeah, it's important to engage all three branches for sure.
Right, for sure. Do you have any funny stories about any interactions with staff members or anything of that nature?
It's so funny. From my grad school program, it was located in DC. I have a lot of friends that actually work on the Hill. So while they were so happily meet with me, I always joke when I was either bringing in former clients in or like going with myself that they love to tell me no. So it's always like you think your friends are going to be the ones that are like going to be the easiest to work with, but no, that's really not the case.
Because they could tell you no, because they're your friends.
Yeah.
I know, totally. I guess that's true.
And when I first got started in this space, this is probably more of a funny story about me, but I was so nervous. I was like fresh out of grad school, just getting out there, and I was very intimidated by Hill staff. So I used to get really like stressed going into these meetings where I was going to talk to them about the policy issues I cared about. So I frankly would look them up on social media, because once you've seen someone in their Halloween costume, they become significantly less intimidating.
Totally.
So it's something I recommend, like if you're going to be trying to get your feet wet out there with staff, just to kind of, and that maybe if your staff, make your social media private because it was not hard to find them.
Oh, geez.
But just seeing someone in their Halloween costume makes things like really down to earth. They are just people at the end of the day. We all go through the same experiences. So just having genuine conversations with them kind of always turns out the best in the end.
That's true. That's really good advice. If there's any, like even just seeing on their social media feed, if there's a certain hook, while you're in Washington, if they're a Washington Nationals fan or something you could bring up while you get inside.
Yeah, if they're from the district and you're from the district and you have those ties and you can talk about maybe you both went to the same high school or maybe you both like the same coffee shop. It's always like great to have that personal interaction.
Yeah, no, totally. That is really good advice. So what are some of the top issues that you're working on Capitol Hill these days? Summer of 2024. What are we up to?
We're in the kind of final sprint before elections,
yes.
Right? Before we get into lame duck session. So one of our top priorities as an organization, and I think many patient groups feel the same way, is the Safe Step Act. So that policy makes it easier to get exemptions from step therapy policies, which is utilization management. It hinders patients from getting their preferred form of treatment. So one of the main sponsors of that bill, Representative Winstrup, is retiring this year. We are so close to 218 co-sponsors in the House, which, as I mentioned before, you really want to get the majority of members on that bill. So we are constantly reaching out to different offices, trying to get members in because we really want to pass that before he retires. So that's a huge thing. Also, the Help Copays bill, which works with copay accumulators and maximizers, which is where, in theory, you should be getting rebates from pharmaceutical manufacturers and copay assistance, and instead the PBM companies will then take that money and not use it towards your out-of-pocket costs, which is unfortunate. There was recently a policy change within the Department of Labor, so here the two branches of government kind of working in tandem, where they released like a FAQ that in theory would bring the cost of this bill. So this bill was, I think, originally scored at something like $10 million. It was not going to be easy to pass, costing the federal government so much money.
Right.
And they, I think, have brought that cost estimate down to zero by fixing something, essential health benefits like loophole with that FAQ. So we're kind of looking to Congress now to kind of assess their FAQ and pull that into the cost there and hopefully get that passed now that it costs significantly less money. A new bill that just came out that we're really excited about is called the 340B Access Act. So that helps create more transparency within the 340B system. I used to work for a federally qualified health center, so 340B is really close to my heart. I know those patients benefited from that program so much, and it's really unfortunate to kind of see hospitals taking the drugs that they're buying for pennies on the dollar and then upcharging low-income patients for them. We want to see those cost savings passed on. So this bill really increases transparency and ideally access for patients. So we're really excited about that. It's very new. So obviously it's not going to pass this year. I can expect that we're going to take this on for many years to come. So excited to get other groups involved on that bill and work together to make that a priority for years to come.
Yeah, those are some great examples. Those are all bills that we're active with too in some of these coalitions that you were describing. And they're all at different phases, if you will, in terms of where they are, in terms of passage. The Safe Step Act, correct me if I'm wrong, this is the third Congress or is it the fourth Congress that's been introduced? So the point being, it takes many, many years. I think it's the sixth year. So I think 2018 was when it was first, if I have that right, give or take, to get it over the line. And it may not make it. We're going to push very hard, as you said, with Congressman Winstrup retiring. Hopefully this is the year, but it takes many years. And we've slowly but surely been building towards that 218 majority in the House. And if we can get to that tipping tipping point, that would be fantastic. Well, let me just ask, just to tie it all together, final question. How important is it for all of these patient groups and patients with different backgrounds to work together to achieve these outcomes?
I think it's critical. I was just at a coalition meeting this morning, and I run a coalition of 65 autoimmune patient groups. I think it creates like an echo chamber for all of our voices. I think going to the Hill with coalitions is really impactful, because then you're meeting with all these members and you're showing that whatever issue you're advocating for has a wide breadth of patient groups behind it, that people support it. And members want to hear that there are patients in their district that care about the issue that you're pushing for. So bringing those people in is a lot easier with coalition work, having numerous groups behind it. So that way, if there are any opponents of the bill, they can be like, this one opponent, but there are 65 groups that support it. It makes their jobs easier to help us help them. So I think it is critical to work together. And that's why, we're on this podcast today, kind of working together. So yeah, I just think all the patient community is so strong, especially like those of us in DC, we see each other all the time. So we're constantly bouncing ideas off of each other and thinking of new creative ways to get these bills passed.
Yeah, no, I totally agree. We achieve more together as patients than we do separately. And that's why it's so important for us to all gather and inform elected officials and others, policymakers, as a team, if you will. So this has been great. Thank you again so much for your time, and thank you for all that you do on behalf of autoimmune patients. This has been wonderful.
Thanks so much for taking the time to sit down today. I really look forward to hearing this go live and look forward to continue to working together.
Absolutely. Thank you, Amanda.
Steven, that was a great interview. It was so great hearing from Amanda about the work that she does, and just reminds me of the importance of groups like us working together.
Yeah, absolutely. It's always good to chat with other patient groups and hear what other groups are up to. Well, we hope that you learned something from today's conversation too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review on Apple Podcasts, and definitely hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.